Inflammation itself is not a disease, but it's featured to varying degrees in many adverse health conditions, such as allergies, macular degeneration, cancer, atherosclerosis and cardiovascular disease, gout, inflammatory bowel disease, osteoarthritis, rheumatoid arthritis, osteoporosis, and more. What follows is a summary of the dietary and supplemental approaches to addressing the general chronic inflammation and the para-inflammation. As many types of general inflammation often occur without additional symptoms, most of the strategies listed are based on their ability to reduce the circulating inflammatory cytokines, which are the hallmark of the para-inflammatory state. Macronutrient content, particularly the type and the level of carbohydrate and fat, can have a significant effect on the progression of inflammation, and this is measured by increases in pro-inflammatory markers. Diets with relatively high glycemic index and glycemic load have been associated with elevated risk of coronary heart disease, stroke, and type 2 diabetes, particularly among the overweight individuals, and they've been associated with modest increases in pro-inflammatory markers in multiple studies. In a study of over 18,000 healthy women over the age of 45 who were without a diagnosis of diabetes, a high glycemic index and high glycemic load diet resulted in a small but significant increase in the C-reactive protein level. This is a measure of inflammation. Since fat tissue, especially abdominal fat, expresses inflammatory cytokines, obesity can be a major cause of low-grade systemic inflammation. So it's important that the total energy intake be proportional to the energy expenditure in order to avoid the deposition of abdominal fat. Obesity-induced increases in inflammatory cytokines appear to be reversible with fat loss. In a dramatic example of weight loss with a gastric band, a group of 20 severely obese individuals reduced their interleukin-6 by 22% and their C-reactive protein by almost half. An inflammatory index developed by a group from the Arnold School of Public Health at the University of South Carolina scored 42 common dietary constituents based on their ability to raise the serum C-reactive protein. Constituents like saturated fat, T polyphenols, and vitamin D were given either a positive anti-inflammatory or negative pro-inflammatory score. The scores were then verified by comparing the nutrient intake and the C-reactive protein levels from a group of 494 volunteers over the course of a year. Among the most anti-inflammatory nutrients based on the model of the study were magnesium, beta-carotene, turmeric, genistein, and tea, and the most pro-inflammatory were carbohydrates, total and saturated fat, and cholesterol. Energy expenditure through exercise lowers multiple cytokines and pro-inflammatory molecules independently of weight loss, while muscle contraction initially results in pro-inflammatory states. It paradoxically lowers the systemic inflammation. This effect has been observed in dozens of human trials. In an analysis of 7 studies on the relationship between weight loss and C-reactive protein, increased fiber consumption correlated with significantly greater reductions in the C-reactive protein concentration. In the study, daily fiber intake ranging from 3 to 8 grams per day for a standard 2,000 kilocalorie diet reduced the C-reactive protein from 25% to 54% in a dose-dependent fashion. The results should be interpreted carefully, as only 2 of the 7 studies were specifically designed to examine the effects of fiber independently. The Women's Health Initiative failed to detect an effect of fiber consumption on the C-reactive protein, but it found the greater intake of the dietary soluble and insoluble fiber was associated with the lowest levels of interleukin-6 and TNF-alpha. In 2 large observational studies, greater magnesium intake was associated with lower C-reactive protein, interleukin-6 and TNF-alpha. Data from a multi-ethnic study of atherosclerosis failed to find a significant difference in interleukin-6 or C-reactive protein between individuals with the highest and lowest magnesium intake, but it did find a significant association between greater dietary magnesium and the lower levels of inflammation-associated proteins, homocysteine and fibrinogen. Magnesium was rated as the most anti-inflammatory dietary factor in the Dietary Inflammatory Index, which rated 42 common dietary constituents on their ability to reduce the C-reactive protein levels based on human and animal experimental models. Vitamin D appears to exert anti-inflammatory activity by the suppression of pro-inflammatory prostaglandins, and it inhibits the inflammatory mediator NF-kappa B. Although intervention studies of its anti-inflammatory activity in humans are lacking, several observational studies suggest the vitamin D deficiency can promote inflammation. Vitamin D deficiencies are more common among patients with inflammatory diseases like rheumatoid arthritis, inflammatory bowel disease, systemic lupus, and diabetes than in healthy individuals. They also occur more frequently in populations that are prone to low-level inflammation, such as obese individuals and the elderly. Vitamin D levels can drop following surgery, a condition that's associated with acute inflammation, with a concomitant rise in C-reactive protein. Low vitamin D status was associated with elevated C-reactive protein in a study of 548 heart failure patients, and with increases in interleukin-6 and NF-kappa B in a group of 46 middle-aged men with endothelial dysfunction. For more on inflammation, continue on the series, or for more on herbs, supplements, and natural treatment plans, check out my website.